In this episode, let's have an overview of coagulation cascade. It involves intrinsic pathway and extrinsic pathway. Extrinsic pathway is initiated with tissue damage with release of tissue factor. This factor activates factor 7 and activated factor 7 then enters the common pathway. When it comes to the intrinsic pathway, it is started with factor 12 and then factor 11 and then factor 9, and this activated factor 9 in the presence of activated factor 8 enters the common pathway. In common pathway, the factor 10 gets activated, and this activated factor 10 in the presence of activated factor 5 activates the prothrombin and converts it to thrombin, and this thrombin is responsible for conversion of fibrinogen to fibrin. This is in brief about coagulation cascade, and now let's understand the different drugs that act in these pathways. First one being warfarin. Warfarin is a vitamin K antagonist, so this inhibits the synthesis of factor 2, 7, 9 and 10. Next is the dabigatran. It is a direct thrombin inhibitor, and followed by rivaroxaban, which inhibits the factor 10A. Then last, the heparin and low molecular weight heparin. Unfractionated heparin has properties of anti-factor 2A, 9A, 10A, 11A and 12A. Whereas low molecular weight heparin has higher inhibitory properties of factor 2A and 10A in comparison with unfractionated heparin. This is in brief about different drugs that act in the coagulation cascade and which have a role of anticoagulant therapy for venous thromboembolism prevention in arthroplasty patients. Thank you.